Well, hi everyone. It's Nancy, the nurse practitioner, and we're going to have a really great video for you today. We're going to talk about a very interesting disease and condition called scleroderma. And it's about 300,000 Americans a year, mostly women. Is that right, Amy? And we're going to be introducing Amy Gietzen. She is going to be our speaker for today. She is a patient advocate for Scleroderma Foundation. She is also a board member for the Tristate Chapter, and she's a facilitator for the younger adults in the group of 18 to 42 years of age that really could use this support. So I'm really happy to have Amy here. I met her on a virtual, I was asked to be part of a support group for the leaders, which was really a pleasure to do, Amy. And I met Amy through this group, which is wonderful. And she's going to talk to us all about scleroderma today. So, hey, talk to us. How you doing today, Amy?
Great. Thank you for having me. So basically, scleroderma is a disease that is rare. It's not a common disease like MS or lupus. Like you said, it only affects about 300,000 people. That's about 1 in 1,000. And I was diagnosed when I was 19. So I started to have some pain with elbows and wrist pain, like I couldn't grip things. So I was working in a nursing home when I was probably about 18. And it's a lot of heavy lifting with patients and things like that. So I just chalked it up to I was overusing. But it kept happening and it would get worse. So after about a year, I went to an orthopedic surgeon. I don't know why, but I did. And I was really lucky to get diagnosed right then and there. He did an x-ray and he asked me to do some simple movements that I couldn't do. And he said, I think you have scleroderma. I had no idea what the word was, what the disease was at all. And so, like anybody who is young, I went on the internet.
Yeah.
The only thing I could find was that it was an autoimmune disease, which means your body fights against itself. And literally the word scleroderma means hard skin. So your skin, your joints, the blood vessels, the muscle, everything gets hard. And I was told that I had more of the more debilitating type of scleroderma, which is called systemic scleroderma, and that can affect your organs, so your heart, your lungs, your kidneys, esophagus. So everything gets tight, hard, and you can develop fibrosis, which is scarring inside the lungs. As you can see, my hands, they get so tight that they kind of curl in a little bit because the skin gets so tight, so I've lost some fingertips. My red marks here on my chest, those are called telangiectasias. And they're kind of like broken blood vessels from the skin being so tight.
Is collagen a protein in the skin that gets affected? Is it a collagen?
So yes, so what scleroderma is basically an overproduction of collagen.
Okay.
So you build up too much and then the body kind of attacks itself. So you can get calcium deposits, which they almost look like bone. They're hard and they can protrude from the skin. I've had a few of those that had to be removed. So at 19, it was really a shock and devastating to me.
Yeah.
I just finished high school. I was in college to become a nurse, like you, Nancy. And I just kept getting sicker and sicker, and I didn't really understand why because there wasn't really a lot of information out there.
Yeah.
It's taken me, in February, it was year 20 of my diagnosis.
Oh, wow.
So it's a blessing, I guess, because, when I was first diagnosed, they gave me 5 to 10 years to live. So it's tricky. Not everybody is lucky like me that gets diagnosed right away.
So before we go on to some more, we're going to show some slides, everybody, but how do you treat scleroderma?
So it's difficult. You don't really treat the disease, you treat the symptoms.
Mhm.
So for me, I'm on immunosuppressives. So that helps so that my immune system doesn't kind of overtake itself,
Yeah.
but then it keeps me in an area where I have to be careful of getting a cold or the flu because my immune system is compromised. I'm on pulmonary medication because like I said, I have fibrosis, which is scarring in the lungs, so it makes it difficult to breathe. I'm also on a lot of uh,
What are you on?
vasov.
Can you tell us what you're on? Like, what do you take for
Oh,
your?
the medications?
Yeah.
Sure. I wasn't sure if.
No, go ahead. I'm curious, and I think some of the clinicians who are watching this video will like to know.
Okay, so specifically for my scleroderma, I take a drug called mycophenolate or Celsep,
Okay.
and that is immunosuppressive medication. And I also take a weekly shot of tocilizumab, or generic name is Actemra. So I do that, and that kind of helps for the stiffness, the joints, and just kind of helps my scleroderma not flare. So keep everything calm, keep the skin as loose as possible. I've had this for a long time, so I've gone through many different medications.
Yeah.
When I was first diagnosed, the only kind of medication they treated scleroderma with was penicillamine. Um, so now we've come such a long way because there's a lot of other drugs that we can take. For my lungs, I have interstitial lung disease along with pulmonary fibrosis and hypertension. So for that, I take Traclear and Cialis. So I know some of you thinking, well, Cialis is kind of like Viagra for men. Yes, it is. But for women, it does a little bit of a different thing. It helps keep your circulation so that the blood flows through and you're not getting Reynolds, which is where your hands and feet turn blue. And that's a common side effect of scleroderma is poor circulation. So
Mhm.
I take that, and then it also kind of helps for the scarring of the lungs. Um, it helps it from getting worse. But this is a chronic progressive disease. So you could take all the medicine in the world, and sometimes it just doesn't work. A lot of patients are on oxygen. Some people are a lot sicker than me.
Mhm.
So it is a really debilitating and devastating disease.
So before we go on and show some pictures, what do you think keeps you positive and keeps you going? I guess you found your purpose in a way. Somebody said to me in the meeting, you've been given a box. And I've been using that a lot with a lot of my patients and people because I'm running a support group, everybody. And I say, this is your box. You have congestive heart failure. You have to take your beta blockage and you must take your ACE inhibitor. You must watch your, salt intake, blah, blah, blah. But everybody has a box. And sometimes the box is a big one. They got to carry on their back, like Crohn's disease and Humira and whatever, or a little box, maybe you have, I don't know, something like dry syndrome. I'm just saying something
Yeah.
easy. You could put a bow on your box. It could be a big, bad box, but just make it as best as you could because it's something you got to carry for the rest of your life. And somehow you have to either put the box on the shelf and say, I'm going to party with my friends tonight, but I'll take my medicine later. But right now, I'm not going to take the box with me. I'm going to
Right.
be like everyone else. What do you think of the box idea?
I love it. I think it does explain perfectly what scleroderma kind of is. For me, scleroderma is a medium-sized box to a large box, and I don't really have the option of putting it on the shelf. I really have to be diligent in my medications and my best practices for myself, and so I carry the box with me, but sometimes I dress it up. Sometimes it's a different color. I think the biggest thing for me was always staying positive and finding something to laugh about because if you can't laugh about yourself and you can't just try to, it's either laugh or cry and never leave your room, right? So for me, it was always find something funny in it. I've gone on a lot of medical adventures. My dad's retired, so he's like my travel buddy. He goes to all my medical appointments with me, so we've had a lot of fun. car rides and traveling, and we've also had some really desperate moments where not much talking, just a lot of thinking.
Mm-hmm.
So it's definitely a journey
Mm-hmm.
for sure.
So everybody, let's, you ready, Amy? Should we show them
Yeah.
some slides just to give them more of an informational visual? So here we go, everyone. Okay, so take it away, Amy.
Okay, so basically what I had said before is scleroderma is a chronic connective tissue disease. It causes the skin and the tissues of the body to harden and kind of get swollen. It can cause a lot of inflammatory issues. And it's funny that you said dry eye, Nancy, because scleroderma can affect you where you get dry eye, dry mouth. A lot of scleroderma patients have the Sjogren's
Yeah.
disease, so it can also do that. It can damage the lungs, which I had talked about with my fibrosis and interstitial lung disease. It can also damage the heart, which is something I'm dealing with now. I'm having some fibrosis on the micro level in the heart. Um,
Mhm.
so it can affect the kidneys. One of the big um, deaths in scleroderma patients in the early years was kidney failure, and they didn't really know what was going on. So fortunately for us, we were able to kind of work on that and come up with some kind of treatment and be put on dialysis right away and able to kind of come back from that. That is not something that I had, but it was very common, I want to say, in the early 90s with scleroderma patients. It can also uh, upset the digestive tract because everything is getting smaller, because everything is getting tighter. So you have difficulty chewing and swallowing. Acid reflux is a really big issue. And then, you're always worried about aspiration in of the lungs. And then it can cause muscle and joint issues. So stiffness, you can't really bend or make a fist, difficulty moving around. So it really affects from the tip of your head to the toes of your feet.
Wow. You just brought up a point. My mother died of Sjogren's syndrome when she was 68, and that was back in 1986 when my son was born.
So
And
sorry.
they didn't know what it was, 1986. And she had actually a wound on her leg, the pyoderma gangrenosum. And it was a wound that just would never heal. And we just kept dressing it up, and the home care nurses were coming. And I was looking it up as a nurse in home care, but we never really knew what it was. And, she died from complications from an IV infection and some other things, unfortunately, but she was not being treated, but she did have dry eye. She actually lost all her teeth when she was like 40 because
Yeah, that can happen because you don't have
yeah,
the membranes in there.
yep, she had no saliva. She had dentures at like 42. So we knew something was up with mom at that point. And she actually went to a homeopathic doctor. She had a juicer. She was doing carrot juice and all sorts of stuff back then. I mean, there was no biologics.
No,
Prednisone or other types of steroidal things were used. Nothing made the wound go away, which got infected a lot. It was not a good quality of life for her back then. And I know it's come a long way. So thank goodness for research. And we're going to go
right.
into that, everyone, because any disease out there, any condition out there deserves the attention it deserves, because there are people all over the world affected by it, and it changes their quality of life. And all you need is some great research done to make so many people happier and healthier and have a better life just because of research. So research is so needed.
Absolutely.
So we'll take it to the next slide. Is that okay?
Yeah, that's fine. So this is different pictures of things that can happen when you have scleroderma in your hands. So the first one is calcium deposit, which I had spoke about before. It's an overproduction of collagen, so it can kind of make these deposits that can protrude from the fingertips, or like I have one on my elbow. I've had a couple on my forearms that you can remove, but they can come back. And they almost look like bone and they're hard.
Yeah.
So when you have something hard underneath the skin and you're leaning on it, it's not very comfortable.
I can
So,
And it's all near bone, of course, right near joint,
right.
pretty much.
hmm
Okay. Puffy
So
fingers.
the one Puffy Fingers is the next one. So, like I said, it's can cause an inflammation. So, especially of the joints and of the skin. So, I honestly, before I was diagnosed with scleroderma, I had always had swollen fingers. I always just thought they were fat. That it ran in my family because my mom and her mom had big hands, but I guess it wasn't because I had scleroderma, and they were always swollen and very sensitive to touch anything, and so that's one of the symptoms that you can have. One of the very common ones is the next one, which is called Reynolds Phenomenon. And I actually was diagnosed with this a year before I was diagnosed with scleroderma. So basically, what it is poor circulation. So your extremities, like your hands, your toes, your fingertips, your nose, sometimes your ears, can turn blue or purple from the loss of circulation.
So this
Um,
must be a tough, and we were talking during the lectures about living in the Northeast or anywhere where it's cold for 7 months out of the year. And I'm saying I'm going out snowshoeing, and that's probably the last thing you guys would do.
that is the last thing that I want to do.
I
And
Being outside in the cold at all, because no matter how many layers you have, you're going to have some circulation issues. Is that right, Amy?
yeah, for sure. And I am from the Northeast. In New York State, so it can get really cold.
So what
So
do
you
you
have
do to
to.
enjoy your winter then? Just because you're indoors a lot, right? Or
Yeah, I mean, you have to just kind of pick the days. Maybe it's only 40 degrees out, so I can bundle up really well and go out and kind of enjoy a hot chocolate, or, I can enjoy the snow from inside by the fireplace.
go south like go south, my friend.
Or be a snowbird, yep.
Yeah,
Um,
it's almost like some people leave states because of allergies
yeah.
or skin disorders, and doctors tell you go other places.
I
You know,
mean, the first thing I was told when I had scleroderma was, you need to relocate to somewhere where it's warm.
yeah,
And my rheumatologist keeps telling me you need to relocate, but I love where I am. I
yeah.
love New
The
York.
sunsets are wonderful. It's beautiful here. It really is. The Northeast is definitely worth seeing. Everybody. So one thing before we go on, I know we're going to look at the rest of the hand pictures here, is I know you've mentioned many systems get involved. So do you have many different doctors, or does the rheumatologist pretty much own all your care?
No, so the one thing I have to stress is with scleroderma, because it's a multifaceted disease, that you need to have a team that kind of coordinates together. So I have a rheumatologist, a cardiologist, a pulmonologist, a podiatrist, a GI doctor. I have a hand surgeon. I have an oral surgeon that does my teeth work. So I have an eye doctor. So it's really about having doctors that will treat each facet of the disease, but will also work together. So
So
it's
how did you
extremely important.
But you also must have a cardiologist who knows scleroderma, right? So
True,
how did
true.
you find this team and do they
So
refer each other and they sort of like or how does this work for you? Because this is something I would want to know as a clinician. How do you find that team for your patient with scleroderma? You know?
So locally, for me, scleroderma was a disease that not a lot of people knew about.
Yeah.
So I had to kind of do my own research and be my own advocate and kind of go online and see where. So I finally found a center at the University of Pittsburgh, and it was like coming home to me. They are um, a teaching hospital that has a scleroderma center. So all of their doctors know about scleroderma, and all their specialty doctors know about scleroderma, and they all work together to treat their patients. So my medical chart is universal throughout the whole center. So it took me about 5 years to find them.
So that's in Pennsylvania.
Yeah, so that's in Pittsburgh, Pennsylvania, but I also have, obviously, I have to have doctors locally,
Sure.
because if in a pinch, if something happens. So I had to kind of find doctors locally who were the best in their field, but were also willing to learn about this disease, because you really have to be a doctor that can think outside the box
Yeah.
and kind of be able to say that you don't really know everything because there's a lot of unknowns with this disease.
Yeah.
So, and then they also had to be willing to work with my team in Pittsburgh because if they weren't,
Telemedicine's helping you, excuse me, a lot, correct? Because even if you can't go to Pennsylvania, you can now do something with your rheumatologist from Pennsylvania, right? If you're not feeling well and there's blood work and he's looking at it and you had it done here in New York, can you do
yeah,
that? So you don't have to go running to Pennsylvania, and even your local doctor who sees you, and then it's like messenger, to the
yeah.
doctor in Pennsylvania.
So, I mean, I would say 10 years ago, I was carrying medical files from doctor to doctor to doctor.
I bet.
Now with like my chart and,
Right.
things like that, it's been so much easier. To be honest, I had never used telemedicine until the COVID hit. But it's really has helped me because I had a flare up where I had a scare and I was in the hospital and I was able to kind of telemedicine with my team when I was in the hospital here and then kind of coordinate things where I would go down there and they were going to do a procedure and have all my records faxed over. So you really have to be diligent in being an advocate for yourself,
I was just
speaking
gonna
up,
say,
asking questions, not taking no for an answer, and you really have to have a good connection with your doctor because it's a very personal disease and you have to be able to have like you kind of have to mesh together. If
there's
it's
one
not a good
responsive you're missing, though. I'm sorry, I'm just going to say, do
no.
you have a social worker or somebody or you are your own social worker because
I am my own social worker, but
yeah,
I would recommend having somebody that coordinates everything. I do have when I go to Pittsburgh, there's a liaison that kind of um, makes all my appointments feasible for the 2 or 3 days that I'm there.
that's great.
So I guess she's kind of like a social worker. They call them a liaison.
They
So
do. It's probably a nurse liaison of some sort. The other thing is having some sort of, and I'm starting to do this at over 60. I'm keeping a book about when I had my last colonoscopy, and I just had one last week and they found a polyp and blah, blah, blah. And I'm just going to start writing things down so I have like my story moving forward, because it seems like no matter what age you are, if you have a chronic illness or you're starting to see things as you get older and the body ages, it's great to keep track of yourself.
yeah.
And
Oh,
just a little
absolutely.
journal, even on paper, because you could lose your phone, you know, or, back it up on your hard drive or something. But it's nice to kind of have that kind of thing, and also have a living will, right?
Yeah.
You have
I
a
mean,
living
you
will.
have to. I
Yeah.
have a living will. I have a healthcare proxy. I have all that. And it's funny you say a journal because I started a journal from the year I was diagnosed, and I'm still keeping it. So one of my goals is to publish some of the memoirs.
That's a great idea. That's,
Yeah,
scleroderma is not going to go away, unfortunately, because it's an autoimmune problem, and there's lots of autoimmune diseases out there. But the question is how to keep it at bay and have the quality of life that you want. So, what about these finger ulcers? I've never seen those when I've seen my patients with scleroderma, but they must be painful.
they are. So they're kind of, if I could compare it to anything, it would be like diabetic ulcers.
Yeah,
They can get gangrenous and for myself, I've had a long and hard history with scleroderma finger ulcers. I've
mm,
had them on my fingers, on my toes, inside my mouth, inside my nose. And they're all kind of brought about. It's probably 50% circulation issues and 50% of the tightness of the skin. So if you hit your hand on something, we can't really regenerate and we don't have the white blood cells to kind of clot because of our circulation, so it never fully heals and then it dies and turns gangrenous sometimes. It can get infected sometimes. I've lost a toe from a digital ulcer that just would not heal, and then when it finally did, there was exposed bone. So obviously, you can't be walking around with exposed bone.
yeah,
that's not that's not a good thing. So those have been kind of like my pitfall. I've
yeah.
had them for years, and I just can't seem to get away from them.
Hmm.
Like all of my, like, I don't know if you could see my fingers,
Yeah.
like I don't have the tips. those are not, they were not amputated. Those are all self amputee from digital ulcers. So
They
once,
sort of fell off or just,
yeah, they kind of fell off, and like you can't reject, we don't have normal skin and a normal immune system to kind of regenerate that tissue.
Mhm.
So once it's gone, it's gone. It's
So
not going to come back.
here's another part of the team is occupational therapy and
Yes.
physical therapy, because there's reachers and there's all sorts of combs and there's all sorts of things. If you know, there's a lot of people who can't use their hands, or their hands change like after a stroke. Um,
Yeah.
so you must had an OT at some point, or somebody, or not
I
really.
had a hand therapist, occupational therapist, and so I've done a lot of that in my first 5 years, and then I've kind of built up a kind of like a repertoire of different exercises, so I kind of know what to do now when
Good.
I'm having stiff issues, or when you rub the skin, you know, when you rub your skin to kind of always rub up towards the heart, things like that. Um, I did have a bout of vertigo that wouldn't go away because of my lack of range of motion, so I had to go see a vestibular therapist. So she was added onto my repertoire of doctors. But yeah, you have to kind of, it's a total package.
What
So you
about
have to.
creams? Is there certain creams that are recommended, like a diabetic
So
neuropathy?
you always want to have with scleroderma, because you have hard skin. There's a lot of itchiness
Okay.
to the skin. So for me, I always use all natural organic cream, and I use oatmeal based cream. So because it kind of oatmeal helps with like the itching and the
It does.
in, inflammation. So, but there are like, you could see a dermatologist. I know a lot of patients that see dermatologists. I don't. I worked for a dermatologist, so I think I got dermatologist out. But I learned a lot of about it just from trial and error. I hate to say, because there's not one, like, I can't say one cream works for everybody because sometimes it doesn't.
Right.
Sometimes your skin is different.
Yeah.
So for me, oatmeal based creams work, and not lotions. It has to be like a thick
Yeah.
cream, and I use it religiously in the morning, at night, after shower, all the time. Sunscreen is a big deal.
I Let's look at this. I've seen this on many different patients for different diseases and problems. Tell us more about.
So
Yeah.
the red spots are telangiectasias. So those are the broken blood vessels I was talking about in the beginning.
Mhm.
And it just depends on the patient. For me, I just got the lucky straw, and I have them all over, in my scalp, inside my nose, inside my mouth, on my hands. You can see them on my arms, on my neck.
Mhm.
And it's not a rash, it's not contagious, but they don't go away.
Yeah.
So I can't tell you how many times I went to the hospital and they're like, "Do you have a rash?" I'm like, "No, no, I don't."
Yeah.
So, and then just, it's kind of just like something that you have to live with. As a woman, it was hard
Yeah.
as somebody who never really wore a lot of makeup. So now I have like a full face when I go out because I'm self-conscious about it. Um, but you kind of have to learn with old age, I guess,
Well,
to
when I had
work.
acne, I had really bad acne when I was a teenager, and it kind of ruined my teenage years. And I was called, pizza face and all sorts of stuff. And it does change you, and how many parts of your body can you cover up? Like if
Right.
you wear a bathing suit, I mean, things like that. So it definitely builds character, I think, partly,
Yeah.
especially for women, because we are kind of vain and we like to look pretty. But I can totally relate to that for sure.
Yeah, and especially because I was so young,
Yeah,
so it was hard for me, with dating and things like that, to feel confident
I bet.
in my body,
Can I ask
especially
you
when.
a question? Oh, sorry.
Sure. No, go ahead.
Pregnancy, is that an issue or a problem for?
So I have never had a child, or had any pregnancy discussions, but I know several of my scleroderma friends that have had children.
Mhm.
Some of them have had some issues and others have not. I've heard that like MS, when you become pregnant, the symptoms kind of go away while you're pregnant, and then you can get like a flare up afterwards.
Yeah.
And then I've also heard of some women who've had their children, and then after their children, they get diagnosed with scleroderma,
Like
because it's some
MS.
kind of,
Yeah.
yeah, some kind of trauma to the body. It's still very unclear,
Mhm.
um, and I know sometimes there's a stigma with pregnancy and autoimmune disease because you don't know if it's familial or genetic. So people tend to say, well, why would you bring a child in around, or, give birth to a child that you could give something to? But the desire to be a mother is something that each person has to go through, I think. So I've seen beautiful, healthy children from patients of scleroderma. I've never seen any scleroderma patient that has had a child and the child be sick. So,
Pretty interesting. It's just a question I had because I know there can be some issues with that.
for me though, I did a lot of chemo, drugs and things early on because I had a pretty progressive disease. So I can't have children because of that. So I had to go through like, do I want to save my eggs and things like that. So I think it's a difficult choice,
Mhm.
um, and situation when you have, when you're so young living with
Yeah.
scleroderma.
Yeah. So what is the average age when people are diagnosed then? I know you said you were 19, but what's
So when I was diagnosed,
mhm.
it was told to me that it was an older woman's disease.
Oh wow.
So 50 and above.
It's me.
But now, 20 years later, I see a lot of younger people getting diagnosed, and maybe that's because we have different ways of, um,
Fine.
blood work and things like that.
Mhm.
And I see a lot more men, and there are children that can get it as well.
And I've seen that in the literature. Do you want to say anything more in effectiveness here? I mean, you talked about many of these symptoms and signs.
No, this is kind of just an overall kind of view of what scleroderma is and some of the symptoms.
Okay, I think we pretty much went over this. So there is some loss of hair too, over the affected area. So
Yeah, so like my fingers, you know how sometimes you get hair on your
yeah,
knuckles and things, that's all gone.
yeah.
I would like it if my legs didn't have hair anymore, but that's not
Don't
really
worry.
what happens. Yeah.
And tell us about this great picture, all these smiling faces.
So each year, the Scleroderma Foundation holds a national conference. It's always the second weekend of July, and it's kind of like a 2.5 day event where scleroderma patients from all over the country, all over the world sometimes, come and they can get educated on with different doctors that do seminars, meet different patients. This picture right here is I was part of an advocacy panel, patient advocacy, and we talked about being a patient advocate and how to kind of spread awareness and educate other people, and how
Right.
to get in touch with your Congress, man or woman, and kind of advocate and lobby for scleroderma. So these are some of my scleroderma friends.
Oh,
Um,
nice. What a great
yeah,
picture. You guys look so great. So let's
yeah,
go back to us if you're ready, Amy.
yeah.
Okay, so you sent me some really great information, scleroderma overview and causes. Love this because it's very, complete.
Hmm.
And from the Scleroderma Foundation, everyone. So those of you that know me from Caregiver Success, I have a Facebook page, facebook.com/caregiver success. I will put the phone number and the site, scleroderma.org, if you want to get some brochures. If you want to be involved in donating through the foundation, how can they help us with that, Amy?
So every year we have walks through the Tristate Chapter, and actually through all of the chapters out of the Scleroderma Foundation. This year they're going to be virtual because of COVID, but
Okay.
you can go to the Scleroderma Foundation website, which is www.sclerodermafoundation.org, I believe. Or you can go to the Scleroderma Tri-State website, which I gave Nancy, and she can probably put in the bio for this video. And then you just go to either donation or Scleroderma Walk, and you can donate there. It would really be amazing to help us get money for research, and for education. So if
And
you,
And another thing is, if somebody thinks they may have scleroderma, can they call a number and go through some of their symptoms? I'm just saying that may like at least get them on the right path so they don't spend a lot of money and time going
Right. So
there.
if you have watched this video or you say, hey, maybe I have scleroderma, I would always say to make an appointment with a rheumatologist or your regular GP. But you can go to the website and they can send you some brochures. You can call the foundation. They can talk with you and kind of get you doing the right steps that you need to kind of get figured out and get diagnosed. They're really helpful with that.
Is the phone number 1-800-722-HOPE?
Yes.
1-800-722-HOPE, everyone. And HOPE, HOPE, is 4673. So 1-800-722-4673. And I will put these numbers up for you on this screen at the end, and also in my facebook.com page for you guys, so we can give you all this information.
If they're also sorry, Nancy, if they're looking for somebody to talk to, if you are a scleroderma patient and you're looking for someone to talk to, Nancy can put my information, my email address. Yeah, absolutely. And I can kind of guide you.
You're great. You found your mission. You know, this box was given to you for a reason. You know, I
Absolutely.
think we all have to think of it that way, and that's why you're doing so well. And you look so beautiful, and you're doing so good. So proud of
Oh,
you, girl.
thank you.
Really
Thank you
are.
for having me. I really appreciate the opportunity to kind of come on here and just enlighten the world about this disease that is not a lot of people know about. So I appreciate it.
Oh, you're so welcome. So everyone, this is my site, Caregiver Success. Is actually it's Caregiver Success on YouTube. I also have a book. I guess I might as well toot my little horn here for the book, Caregiver Success, which is for caregivers. But you know, we're all caregivers. We take care of each other, our friends, our parents, ourselves. And it's about everything from soup to nuts. I do not have anything on scleroderma in here, though. However, ooh, I might have to do that second edition. And you can get this at my caregiversuccess.com website if you're interested. Well, thank you for joining us, Amy. And to everybody out there, take care of yourselves till the next video. We'll see you at the next one. And please subscribe if you like my channel. Thanks from Nancy, the nurse practitioner. Bye, everyone. Bye, Amy.
Bye. Thank you.
You're welcome. See you.